Welcome back to Not Alone with Melissa Sue Methvin. Today, I have a very special guest. I am so grateful for her time and honored to have her on. It's Dr. Preeya Gens. She is the founder of the Whole Tooth Dentist in Dallas, Texas. But how we met is very special. I was asked by Dr. Delphine here in Sedona to be a breathwork facilitator for her retreat for 7 wonderful dentists last February. And I was honored to meet Dr. Preeya. And I still remember going for a hike, and you explained your dental practice in Dallas. And I was just in awe that your foundation was actually in treating the nervous system before their appointment, during, and post. And it really got me intrigued in finding out more of what you provided in the dental practice. And I was like, wow, more practices need to lean into treating the nervous system along the way, because I do truly feel fear is the number one thing that patients feel when they're in the dental chair. And unfortunately, as a provider, we try and take that on. But so the way that you treat the nervous system as part of the treatment plan is like nobody else that I've heard. I'm sure there's others, but I know you do it differently. And I know sometimes that could be kind of lonely as well, because you are doing it differently and you're navigating a different path in the dental practices. But I truly felt that you can be that blueprint for other dentists that want to go this route, but don't know how. And you can guide them along the way how you got started. So anyways, I don't want to take all that on, but I really want to give an outlook for the listener, what we're going to dive into. And it's really, what if we introduce nervous system regulation in a dental practice and how that can benefit the patient and the dentist overall. And so welcome. I'm just really excited to have you on.
I'm excited to be here. I know it's taken us a while to actually coordinate this. So
yes. I kept on going nudging, planting that seed. I'm like, come
on. We're going to do it one of these days. Yes.
With your busy schedule, though. And so that's why we're here today, and it's all in divine timing. And I'm just so curious, because I don't think I ever heard as to why you got into the whole biological dentistry, holistic dentistry. What opened that door for you?
Such a good question. I think it's happened over time. I've always been a more holistic thinker in everything that I do, and I've always been very curious. I always love to meet and converse and connect with people and understand what makes them tick and why. And so I think the first prerequisite to biological dentistry is to be very curious and to ask why and ask why again, and be open-minded, because the answers you receive are not always the ones you expect. So for me, I grew up in Canada like you, and to an Indian family. And so we never really went to the doctor unless there was like a really pressing need. Most things we could heal truly by just allowing time to pass, right, and to nurture your body. As I got into dentistry and dental school, it was much more dogmatic, right? You do this, you do that. It's very prescriptive. It's very within fractions of a millimeter and angles. Like if you don't have perfection, you're dead in the water. And, made it through dental school, and that was fine. We did what we did to make it through. And then I started practicing, worked at a doc in a box in Virginia for almost a year, and it was awful. We'll not dwell on that, but all of these things are formative in the experience. But even then, I remember my first day practicing, we saw like 30 patients, and I'm used to seeing one patient in the morning and one in the afternoon, maybe if we're lucky, and now I'm seeing 30 with paper charts and film x-rays, and this is not fun. I don't get to connect with people. I don't get to talk to them. I don't get to understand anything about what's going on. It's just you see what you see, you tell them what they need, and they leave, and hopefully they schedule and they come back and they do the work. And it's just kind of this rote cycle. Moved to Washington State after that to work at what I thought was kind of the dream dental practice, where I started learning more about comprehensive dentistry in a way I hadn't learned before. It was with a clinical instructor at the Coyce Center, which is in Seattle, And John Kois is very big on looking at the whole person, even though it's not holistic dentistry per se, but looking at the person and considering all of the different risk factors that go into what we see in the mouth. And so really thinking about each patient as an individual. All of his teachings are very based on evidence and changing evidence. And he shows you his mistakes. He shows you, things that he's been doing for years. And oh, wait, something new came along that's better. Let's adopt that. Let's not just stick with what we've always been doing. So as I learned that, and as I realized that wherever I went, I was that dentist who wanted to spend time with her patients in the face of like, well, you need to be productive, you need to produce, you need to be faster, you need to, do the things. But the issue to me was like, but if the person's not truly comfortable and they are very anxious and they have a story that needs to be told, like how do they possibly heal? How do we actually make the difference that we need to make? And so for many years, up until really 2018, when I finally bought my own practice, and I started in 2007, bought my own practice, named it The Whole Tooth, not realizing exactly what I was doing when I named it. It made perfect sense. I had this image of like what's the man, Da Vinci's, the man with the arms
Da Vinci
out.
Code, yeah, yes.
Well, I'll remember at some point. Anyways, that was the image I had in my mind of this just interconnected human being, and we're at the center of it. The mouth is that portal. And I thought of holistic with a W, right? We're looking at the whole. And so started building this practice. And as I built it, and also knowing like with my daughter, she was born in 2012. With her, we lived in Washington State. We were, I was very big into breastfeeding, cloth diapering, really trying to make things as clean and natural for her as possible. So even, all the dairy she was consuming, I was bringing all the food to daycare and to school, because I was like, I don't want her to have whatever, the USDA dictates is healthy. This is garbage. Mm-hmm. And so it was one of those opportunities for me to align what I was doing in my own life with what we were doing in practice. And the more I learned, I saw people who as dentists, we're in a super toxic environment, right? So we're constantly like at one point placing metals, mercury, and then we're removing this stuff. And it's like, I remember holding it in dental school. So we're like working on a little Typodont plastic tooth and like messing with stuff. Like this stuff is all over. It's in our systems everywhere. And it doesn't just stay superficial. It gets lodged in our organs and everywhere else. And so we're constantly creating and subjecting ourselves to toxicity. And as women especially, I saw my peers struggling to get pregnant, struggling to stay pregnant, children being born with just different challenges. And I thought, like, this seems like a lot of people within this one field who are having these challenges. And why is that? And so all of that kind of, all the stars.
Did you ever get tested for mercury levels at any point?
Not physically tested. I've had some energetic testing done, okay, and I'm high in mercury that way. The physical testing is challenging, and it's starting to be more of a conversation in dentistry, even like amongst people within like the Kois Center graduates and stuff. And what they don't necessarily realize is that if you're just doing like a hair test and it comes out either negative or positive, that's fine. At least if it's coming out with something you're detoxing, showing up in our hair and our tissues. But what you don't detect unless you do a provoked test with chelation is that there's a bunch of that stuff in our organs, in our brains, in our, lodged in our bodies that you can't detect with a simple blood test or a hair test or any of that. I think anyone in the dental field has to be at least somewhat mercury toxic, and especially if you then have any kind of mutations, like the MTHFR mutations, like you're not excreting that stuff.
Yes. Yeah, I got tested for that, and my kids as well, once I heard about the MTHFR gene. I did the metal testings on my kids. And interestingly enough, what I learned, and I don't know if you've heard that before, that mercury levels could be passed down as well. So my kids had mercury, And I was like, oh, well, how do they, well, of course, vaccines and things like that too. But I did hear that could be passed down. And Scott, I know all he did was remove amalgams.
Oh
No,
yeah.
so he was like cosmetic dentist forever. So I know that played a big role in his mental health. Absolutely.
Oh, for sure. And that's the scary thing, right? We see the dental suicide rates, even present day,
Oh,
are,
yes.
and that's got to be
They're
a big.
high. I almost get a text now, monthly, if not, and it breaks my heart every time because people will know to reach out to me and say how I could maybe talk to the wife, and now they have the kids, and how I process that, because there's so much logistically when you own a dental practice too. And now you got to keep things running. And anyway, so it always breaks my heart. And that's why I got curious too, asking, well,
Yeah.
why is the dental profession is so high in suicide, burnouts, and so I love that you bring that up, that awareness of the environment alone, of the toxicity, and I'm sure sensory overload, I know, is a big one too.
Yeah, sensory, the sounds that we listen to. It's interesting, and I think we see that in our patients as well, where people who have more capacity heal better, right? So if you're in a situation where you're toxic or you're not sleeping well or there's some stress or strain, it's only a matter of what straw is going to break that camel's back. And so within dentistry, yes, we're faced with stressors galore, from running a business to, doing microsurgery in a dark, wet environment 3 inches from the brain on someone who's wide awake and doesn't want you to be in their space, who has a bunch of trauma. And like, what we're asking for trouble. And then we're taught in dental school that perfection is the standard, and perfection is microns, right? Fractions of microns. And so it really kind of sets us up for some sort of burnout or failure if we don't have built-in ways to tolerate it. And I think we do ignore the concept of toxicity as a major contributing factor in all forms.
In all forms. And I'd love to kind of what you see, because now explain to us, like if I came in to be a patient, I know you had talked, you have a treatment plan for them where you actually get to spend more time getting to know what's going on as a whole in their life and where they're at. Are they the patient that's pretty calm, or are they coming in and they're hectic? There's a lot of stress and whatnot. And so you really try and create a safety, a network with them first. And you also have, I know you've mentioned some breath work. So guide us through the appointment with you.
Sure. So this is in perpetual evolution. So in the latest state that it's in, what we're seeing a lot of is people are just overwhelmed with the state of the world and the economy. So they're coming in stressed, more strained than ever. What we try to do is, first of all, our space is just very calming. And so we try to keep fluorescent lights off. We use a lot of natural light. Instead of walls, you have a window that you're looking out over into our garden, which is not looking great right now because it's winter, but it's nature, and we see birds and squirrels and other things in there. But we have the space kind of curated to kind of help calm the nervous system. So we do have essential oils usually flowing, and we've got music that's relaxing, not quite spa. It's usually kind of like chill Texas sun music, little Khruangbin. And then the team, we're not in white coats. We're usually in black scrubs, and dressed a little bit more comfortably to sort of exude that level of comfort as well. And then we have an exhale suite, which I think is really fun.
I love that.
Yes. And so patients are offered tea, and we have a couple custom blend teas that are actually from New Mexico. And they can come sit in the exhale suite, although that's about to shift. But exhale suite is, it's kind of in the center of the practice, kind of the heart of the office. And it has like a little salt lamp and some dim lights. And we have a infrared sauna in there, a far infrared sauna that you can sit in before or after treatment. And then also a Reiki table that has a red light, like a lumen red light that goes over the face, or could really go anywhere over the body, but we encourage our patients to keep their clothing on. So usually it's more just facial in nature. And then we have the aromatherapy choices as well. So typically the exhale suite is designed for post-care, post-treatment. And the idea is that it helps us to detoxify, recover, and kind of reset our bodies and reorient to the world. What we've developed for this year is our inhale suite as well. And so our inhale suite is an operatory that we bring patients into. We typically are going to take a swab of their saliva or their biofilm and put it under the microscope to look at and evaluate like who's swimming around in there. But more than that, this is now a space where you're kind of like taking your shoes off and leaving the world you just were in, sitting in this space. You've got a beautiful view, and we'll walk you through a guided breath work to help
I love that.
you prior to care. And we're also starting to introduce Sonu, which is it's a headband that uses acoustic resonance to clear your sinuses. And they say that like within 2.5 to 3 minutes, it puts you into more of a delta state. And so the idea there is also that we're just continuing to calm the system and make it more receptive to whatever procedures are about to happen.
Yeah, because if they're in a fight and flight state, if they're nervous that come from the world, I'm sure you've seen as a provider, they can't heal properly.
They can't
right?
heal, they can't receive. I mean, even doing some of the simplest, I say simplest to us things are putting their system into just a tizzy because they're very afraid. And in Texas, we're required to take blood pressure before we start anything. And so we're looking at these blood pressures and they're through the roof because where are they? And what did they do to get here? They were probably driving fast. Dallas traffic is terrible. Drivers are terrible. I mean, you're playing like Mario Kart on the street on your way in. Like it's not the place where you can just suddenly calm down. And it's the place where people are more typically anxious. So yeah, we're really trying to treat that system first so that it can receive the care it needs in a way that it can then heal from it as well. And so even in the chair, a lot of times we use NuCalm, which is kind of my replacement for nitrous oxide. As soon as I purchased this practice, I took the nitrous out because I don't like it. A lot of people with MTHFR can't detoxify from it. I'm just short-waisted and I can't work over it, and I would get headaches, and I just didn't feel that was necessary. And honestly, I haven't had a need for anyone to use that in our office. Even some of the most anxious patients, we can get them to a place where they're comfortable and they're okay with us being in there, which I think is great.
It is really good. And I'm sure you see a shift maybe even for you if they're calm and if you can work with them, then you're not taking that on a daily as a provider. Like, have you seen a shift like from when you started and not doing these kind of protocols to how you felt at the end of the day compared to how you feel now in the environment that you're in?
Yeah, I think it's very different because, we are energetic beings. And so especially as dentists, when we're touching people, we're receiving a lot of that energy. And so when we can kind of better contain it, I think that really helps us and the patients to not have that anxiety there. And really, I mean, we want to focus on doing what we do best, not on managing the anxiety that surrounds it. And so with the NuCalm especially, that was a dramatic shift. It's great because it does provide some benefits neurologically and cognitively. So they use it in like the Olympic Village for recovery between events for the athletes. So added benefits there, but then patients, they don't say that they describe it as like this incredible experience, but once they're in it, they're still, and the passage of time is somewhat irrelevant, and they're just kind of there. And so we're able to do what we do, and they're just semi-present, semi-absent, and it's a beautiful way to do dentistry, I feel like.
Yes, yeah, absolutely. Absolutely. If they could be calm and then you can focus on what you, instead of them being so tense and half the time they're like twitching because they could see the, either if they see the needle coming in or, oh, what's this tool?
Yeah, exactly.
Yeah. So I think that's what I love about what you're incorporating, because as I got curious as well, really was important to learn to incorporate breath and
Yeah.
nervous system tool in a
Mm.
dental office. And that's why I'm telling dentists, even for themselves and between patient, you wash your hands every time. Why don't you take a few deep breath while you're
Yeah.
doing that? Or when you're doing local anesthesia on the patient, when you're numbing them, allow to do breath work before you inject them and just make them feel calm, because that gives them so much anxiety to see that needle. And how we can shift the environment that's sterile, the smells. A lot of people
Oh,
complain
yeah.
about the smells and the lighting. So I think, where do you see dentists find challenges to shift this direction? Because in the retreat that we were at, there was 7 dentists, and you were the only biological dentist there. But since
Oh.
then, I think
Nope, too.
almost all of them have been open to change. And I am really
Yeah.
passionate to see more of that happen. But I think there's a block because of how, and of course, you need more time. And they're like, well, I need to stay afloat. Uh, you know, time crunching, I won't see it be productive. And also we need to show the patient the value of doing that. It's not just extra fluff. It's
Yeah.
actually going to help them heal. Like even explaining how, let's say you had to do an extraction, but if they're in a fight and flight, well, this could cause them to not heal properly, and in a long term, maybe get an infection, which is called cavitations, right?
Mhm.
And or what about go into root canals, and so this could play a major role in the long term for them to heal and
Mhm.
avoid any infections or gum disease.
Yeah. I mean, I think it's the way to do dentistry for everyone. But there's a lot of different obstacles in our path. I think it starts with us shifting our mindset, and it's easy to fall back into the old mindset that we've been taught as well. We've been taught to believe that we have to produce, and we do. We've got to keep our doors open, our lights on, and our teams fed. Um, but there's an element of like, I guess because we're doctors of the mouth, that we feel uncomfortable almost asking patients to do some of these things because they feel woo, or they feel like it's going to take extra time, and I don't have that time. And conventional practices are built that way, right? They're built to maximize the number of patients in the chair, the amount of care rendered, and how much they're collecting, especially if they're insurance based, because you have to be respectful of your overhead. What's it costing to stay open versus what am I making? And so and dentistry is expensive, right? Every single thing we do has a dental tax added to it. You can buy an autoclave for a veterinary office that's doing the same thing. It's the same exact model, and it's a quarter of the price, which is crazy.
Yeah. Oh, I know. I mean, dental chair. Oh, we need a new dental chair. Well, that's so expensive. Everything, every little thing
But then
people
like a
don't
spa
realize.
chair that's almost
Yeah.
the same is a fraction of the price. And so it's frustrating. But point being, what we do, just the cost to do general dentistry the normal way is one thing. When we suddenly decide to, not suddenly decide, but when we want to take more time, so instead of seeing 5 patients an hour, we're seeing 1. And we need to have the knowledge to back it up, which means we are seeking additional education. We're seeking ways to perfect what we're doing or go deeper or ask better questions. All of that's taking more time and education and knowledge and time away from our families and the things we may otherwise want to do so that we can deliver this other form of care. And then maybe we need other resources. Maybe we're ordering or buying a machine that makes ozone. Maybe we're doing these different things. And now that we're doing these different things that are not in the conventional realm, we're having to also kind of protect ourselves legally because we have to stay in our lane and we have to do things that are safe. And those that are overseeing what we do don't understand it. And so there's just this crazy tension of things that make things cost more, take longer, create fear, on top of okay, now we need to treat these patients. And everybody deserves to have extra time with their medical provider. Everybody deserves more time and expertise, but there's only so much time we can give. And so it's interesting and it's tough. And you have to really, if you're going to do it, you kind of have to do it. You can't really go dip your toe in and just do that, because you're not serving yourself or your patients the way you ought to if you go part of the way. I don't know if that makes any sense.
Yeah, that makes sense. And then I'm sure once you go all in, what keeps you going all in is probably seeing the changes in your patients, in yourself. And so, okay, you start believing in this technique and it really works, because a lot of it is not going to be covered by insurance.
Right.
And so it's also building that trust, the patient, to understanding why it's not at every dental offices right now, because there's a lot of fear. It's not what your foundation was at school. So they have to, it's kind of like in life. We have to
Yeah.
shed layers of old beliefs that we were taught as a young child, that was ingrained in us by, like you said, dogma or whatever, society, our environment.
Yeah.
But as we get older and we do the work, the inner work, and we trust our intuition, we're like, oh, you have to shed these layers. And that's kind of the same thing in the profession that I'm seeing now, is that, okay, yeah, this was built on an old foundation, but we're finding out new findings now and how we can help the profession. Obviously, this is huge right now. We're losing a lot of dentists to suicide, right? And there's so many people not wanting to step into a dental office right now because of fear. So they'd rather have infections, mouth aches, all the things, because there's so much fear just stepping in there. So if we start educating the patient that there are offices that offer this, where they would be so held in safety, and this would change, because like you said, the mouth is interconnected to all of our organs. So if we don't start looking in the mouth first, which I know for us, when people had dental emergencies and we weren't open, and the only day we weren't open was Sunday, they had to emergency. Well, none of the providers there were prepared for oral infection, anything dentally related. But I think there needs to be more knowledge that a lot of it does start in the mouth. It does start. It's a mirror. It's a mirror of what's going on in their life. And it should be kind of the first place providers look at, is in the mouth and what's going on.
It's so fascinating that we just forget about it, right? And interesting, because we're real quick to make sure that superficially our hair, our nails, everything's done, everything's maintained. You'll drop 300, not you specifically, but people will drop $200. I don't know what you do, but you look beautiful. So
Thank you.
We'll drop, let's just go with the we collective.
Yes.
We'll drop a lot of money every 6 to 8, 12 weeks to make sure that things look good on the surface. And that's great. But then when it comes to here, it's like, oh, well, I'm only going to do what my insurance covers, and I'm only going to do it every 6 months, because that's what that commercial on TV told me. That's what every dentist has told me. Everybody has told me the same thing. I just have to come in twice a year. I just buy a toothpaste that has fluoride, and maybe it's a sensitivity toothpaste, and I floss, which I don't. But I do all those things and I should be fine. And everything's good, right? I can focus on
just give me the whitening. Can I just have the whitening?
Give me the whitening. And you're like, okay, cool. That's great. What if we focused on this mouth part of things and this was healthy? Is it possible that your hair and your nails and all that stuff might grow better, because what's happening here impacts what happens outside? So it's that beauty from within starts to radiate because this is healthy. And I think that's really true. Like, if you actually were to pick a place to invest, I would start here, because so much of the things that show up as symptoms in the rest of the body, blood sugar, cortisol, weight gain, all of that's coming from the mouth.
Yeah, can you explain that? Because so many people, that'd be kind of the last place they look. What you've just mentioned, weight gain, cortisol, and then sugar is like glucose right now is just high. So can you explain that as to why would it be in the mouth? Like, what have you seen?
Absolutely. So I think one of the biggest things, and someone asked me at a party a while back, like, what's your number one piece of advice as a dentist to patients? And I was like, it's not going to be what you think, but it's breathe through your nose. Your nose is the thing that's designed to filter the air, heat and humidify, and do all the things that allow us to breathe efficiently and effectively. But for most of us, the mouth becomes that thing. And when the mouth becomes the filter, nothing else is good because it starts to become inflamed. The tissues dry out. The pH or the acidity of the mouth, the acidity increases, the pH decreases. We are no longer using our saliva to buffer and to clear pathogens from the mouth. And so it creates this opportunity for bacteria and parasites and all sorts of pathogens to start living in this system. And this system is so intimately connected to the body. You're 3 inches from the brain. You're right into the blood vessels. The fastest way to get medications into your body and absorbed is beneath the tongue. So if this is not healthy, number one, that's what's happening. The other thing that's happening when we breathe through our mouth is our airway gets smaller, and it doesn't allow us to effectively breathe well while we're sleeping. And this is kind of a chicken and egg cause and effect thing, but structurally, our jaws are more receded. Our mouths are too small to house the tongue that lives inside of it, and our tongues are often restricted or tethered, and the tongue can't function the way it's supposed to. So it's not helping our mouths to grow properly. It's not helping create the proper seal when we swallow, so we're swallowing air. It's blocking the airway when we're trying to sleep because it falls back into our throats, causes snoring, lots of issues there that begin in the mouth.
So then you don't get the quality of oxygen that your brain needs. Yeah.
Exactly. And then as we age, there's ways, they always say, you've got that child who's got ADHD and they're bedwetting and they always have all the ear infections and strep, and it's this perfect storm. And I look at the child and their faces, they've got hollows under their eyes, the bags under their eyes, their mouths are hanging open. There's so much happening there. And their doctors will say, oh, they'll grow out of it. They'll be fine. They don't grow out of it. They grow into it. Their airways grow down, back. They become more of a mouth breather. They aren't sleeping well. Their bodies, their anxiety levels are higher. Their focus is never quite the same. And sure, their bodies adapt to manage it, or they take medication to manage it.
Or they have surgery. They're told to have, sinus surgeries and things like that.
Yeah. And so many times we can fix it just by shifting how they're breathing and what their tongue posture is and creating the structure they need. And we don't really see children under the age of 12 for the most part anymore, because I have tried to create this environment that is more conducive to relaxation and less stress. And so as my kids grew, I was like, I don't want to do this anymore. But what we do see is that the apple doesn't fall far from the tree. So if your child's like that, look at yourself. Look at the things you're dealing with, especially as I'm in this lovely phase of perimenopause where, things don't operate the same way that they did. It's kind of like having that old Honda that worked for 20 years and it was doing great. And, you replace the tires, you replace all the things. And so it's basically new, but in an older body. And it's chugging up the hill and it's chugging up the hill and it's chugging up the hill. And it's been compensating and compensating. At some point, the compensations end. And for us as women in the stage of perimenopause, when hormones are doing their thing, I think that's where the compensations really start to be very obvious. And we see more sleep issues, more nighttime awakening. You're
I hear
told,
that all the time. Oh, they're like, I can't sleep. I can't stay asleep. And I hear that.
Then you're taking all the things, right? You've got a melatonin sour cherry cocktail and magnesium, and you do this, you do that, you do the other, and you're like, okay, well, this is okay. Now I just get up once at 2 a.m. and then I'm fine. But the reality is, have you looked here? Have you looked at your sleep? Have you looked? So many of these people are wearing night guards, can't sleep without it, which is actually dangerous if you have a breathing issue. They've got tension here. They've got all that tension in their jaws. You see recession developing on their teeth, and that's usually what brings them in.
Clenching,
they're clenching, and that clenching isn't. It's stress, but it's stress because the body can't tolerate the level of stress that's happening. And it's also a way that when you engage those muscles, it makes more space inside the mouth. And so sometimes that's an adaptation too. But it's like this perfect storm. And so everyone's like seeking these different answers and these pills and these things to biohack. But if we really started here, we could change a lot of things, and we could also probably save a lot of teeth, because these are the same women who are like breaking and cracking teeth and needing root canals and extractions and stuff. And they're like, I don't know what happened. I'm just falling apart. I'm just
Yeah.
getting older. But
Right. We
that's
just kind of make it like, oh, it's common. It's part of aging.
no big deal. I'm like, no, it is a big deal. Like, I can help you. We can do things. You can actually have the vitality and the joy and the energy that you want and need. But we do have to start in the right spot and ask the right questions. And then some of those hacks are good and supportive, and some of them, to me, are just kind of you're kicking that thing down the curb. Like, eventually it's a problem. And that doesn't even start to, that's not even thinking about like if your brain's not resting and resetting and you're in this sympathetic overdrive and it's not detoxing. That's where we start looking at Alzheimer's, dementia, stroke, all the heart disease things that are really big and scary. And you see them in aging parents and go, man, I don't want that.
Yeah.
Okay.
Yeah, and it's getting younger and younger. Now I see it as some friends'
So,
parents. It's happening younger for them.
yeah.
And I'm so glad you're bringing all this up, because it is. I had got into Airway with my son because I noticed it when he was 3, always so tired. I'm like,
Yeah.
oh, why is he so tired? So a few times he would sleep beside me, and I documented a couple times of him having sleep apnea. He'd like stop breathing almost. And then I started noticing, and I was like, oh my gosh, it's like his airway. And he was a 2-finger sucker. So it was like open. And so we dove into all airway in our dental practice as well. And I see a huge shift. We're working with another orthodontist here with him, but it's, doing the expanders and the face mask and all of that, just because he was in the red for the quality of oxygen. And we all know neurologically for brain health and vitality, it's so important. And like you said, so many kids can be misdiagnosed when it was an airway issue. And I love that you're like, well, if the child's like this, look at the parent too. And now it got me, for so many of my friends that their child has this airway, I'm like, oh, well, let's look at mom too,
Mom. Yeah.
Mhm.
And dad's,
Yeah.
it surprises me how many couples sleep in separate rooms.
Yes, because of snoring. Yeah.
Yeah. And
Yes.
that's
Yeah.
a fixable issue. And if we don't fix it, someone's dying prematurely. It's just, that's the physiology behind it, but we don't take it seriously enough.
No, we don't. We don't. I mean, I've heard so many, with the heart issues and heart attacks, never being interconnected to the mouth, but it really is. So I'm trying to not create fear, because,
Right.
sometimes I put out this information, and I know if their nervous system is already stressed and like, oh, this is so much information, I don't know what to do with it. It's more of planting those seeds. You don't have to do something like right away, just one step at a time. My first step would be find a biological dentist, find one that is knowledgeable in airway. Go with that first step. First step is finding someone that is knowledgeable and take you step by step. And I love for you how you do it differently. You're going to work on their nervous system, because you can see that's a big part of their healing, and they have to believe in it as well. They have to believe in the process themselves. And so bringing that awareness of airway is been huge for my family. And now I cannot help but see it. And like, I see little kids, my kids' classes, and I do see the bags and the sinus issues, and they got the ear infection nonstop. And I'm always
hard to bite your tongue too. And
yes, it is, because sometimes I do find I overwhelm parents with the information that I have.
Yeah. And that's the thing that I think in biological dentistry, and where we're kind of taking more of a step back in my practice too, is it is so easy to overwhelm, because we have all this information and we know we can help you. And so we want to share it, and we're like, okay, so here's all the things, and and we have to remember that there is a person behind the mouth, and that this didn't happen overnight, and it's going to take time to get you to where you need to be. And so we can do this a step at a time as your body's ready to do the thing. And so for like airway, that is perpetually evolving in my practice and what we do. And now what I'm really looking at is, when people have sleep breathing issues and their systems are taxed and their anxiety is at an all-time high and they aren't ready to hear all the things. And so we can start by giving them a few tools to work with to expand their capacity, to decrease the anxiety, to give them space to even consider the possibilities that exist, because you really don't know how bad you feel until you feel a little bit better. And so that's what I'm really working on right now is what are those baby steps that still allow us to commit big picture, but only as much as we're ready to do. And it's, not the data dump that I've done at various points in this journey where I'm like, here's all the things. And yes, here are the good things, but all you hear is the bad, right? And so it's how do we give you what you need and only what you need to make the next 2 steps work and count and then keep going. But that's so very different from what we do in dentistry and medicine. And patients are expecting something different. And as a people pleaser, I want to provide something different. But what I'm seeing in response is they don't actually want necessarily exactly what they're asking for. They need to be held. They need that space. They need to be seen and heard. And then led along the journey as their bodies and their systems allow them to get to the next phase and level.
Yeah, that makes complete sense because I feel I overwhelm sometimes people with or information and I'm like, oh, all about the truth and tell them. And then I could tell, oh, that was just too much. I could just feel it. They're just really overwhelmed and like, oh, okay. So how can I change that? And maybe making those baby steps instead. Like, for example, when I talk, I've had several doctors on talk about root canals and how now maybe that's going to spiral that patient to be like, oh my gosh, I have root canals in there and create that fear. And they're going to want to go to their doctor now and say, oh my gosh, I have these root canals and I hear it's really bad in my mouth. Just pause. I don't want you to just need to do something now. Just start thinking maybe, okay, I do have root canals, but have I been getting some possible symptoms? Like, well, how would you help someone navigate that? They hear this information out there right now about root canal and maybe how you can explain in your way. I know I've had Dr. Michelle Jorgensen. I have now had Dr. DeSanti. And so just your way to explain that and how not to overwhelm the person with information.
That's a work in progress. Yes. The not to overwhelm piece, right? And that's the hard part because we can give and people receive as they receive, but we want to temper the information and it's hard. But with regard to root canals, if you take a cone beam 3D scan, 9 times out of 10, you're going to see in a root canal treated tooth that there's something going on at the roots of the tooth or in between the roots. So that's number one, that they're typically not the best things for your body. We all have different levels of tolerance, but at the end of the day, is that potentially a burden that's being held in your mouth that's preventing something from healing or from flowing well? Very likely so. But is it a means to an end? It can be. So I think for the patient, my job is to inform. Here's the benefits. You get to keep this tooth in your head for longer. For some people, that's really, really valuable, right? If we're trying to grow a mouth, grow a jaw, it grows better when there are teeth in there that we can hang on to and start to move things. If it's in the aesthetic zone or if you're very strongly medically compromised, that becomes tougher because an implant isn't always the best option for somebody. For whatever reason, they can't tolerate the surgery. Well, we may need to buy some time. And so a root canal would be appropriate if we're trying to buy some time. If you are low risk and you don't have any major issues, system's very robust and very tolerant, it may be something you want to do, again, to buy yourself some time. But on the flip side, the risks that we're looking at are potentially reinfection or continued infection. We cannot fully detoxify and clean out and disinfect a tooth that's dead. And once it's dead, it is a dead organ in our body. our body doesn't provide blood to it anymore. And so it can't cleanse in and around it as effectively as when it was alive. And it doesn't recognize it as self. And I think that's the big thing to kind of think about, is like, we don't hold on to other things in our bodies once they're dead. They go away because our bodies will reject it. From an energetic perspective, it's like a block in the energy. And so Chinese meridians, when you're looking at what's attached to each individual tooth and what organ, a lot of times we see things up and downstream that are impacted negatively when there's a root canal there, and that go back to normal once it's gone. So I think it's something to really be aware of. The other thing to be aware of is, like, why did you need that to begin with? If the tooth is cracked, if the tooth has had extensive decay and is breaking down, why is that happening? Because if we don't fix the why, and it's related to force, it's related to acid, it's related to an imbalance in the ecosystem of our mouths, is doing a root canal and keeping that thing in your head solving any of the problems? Or are we just kicking it to the curb and down the road? And then when that fails, now you're putting maybe an implant in, and we haven't fixed the problem still. And now what you're dealing with is a really foreign body that the body doesn't want.
Which is usually metal, titanium.
Metal.
And yes, yeah.
And then that's a problem. But on the flip side, replacing a missing tooth is still a real challenge, because mostly metal implants. And now we have zirconia, which is glass, as an option, but not everyone is actually biocompatible with that as well. And the healing process with the zirconia implant is very different. And the failure rates, depending on the type of implant, can be a challenge as well. And there are not a lot of surgeons who are open to placing them. And so
I love the way you describe it. And that's why I think if we, from the very start, before we even need root canals, that's why I've always been more about preventative health. I've seen naturopath in my early 20s. I've always been more on the preventative side. And I think this is why it's like, if we start doing dentistry where we're looking at a whole, and like you're doing the oral biome test, the little swab test, let's see what kind of microbes you have in the mouth, right? That might be causing this decay. Are you nutrient deficiency? Are you getting the right nutrients? Is it going to your teeth? And because that's what keeps it vital and strong. And how's your gut health? So it's all interconnected. So that's why I think it's good to understand in one step at a time and bring that awareness. I know it's a lot of information, but it's also vital and could give you, something's been off, I've not feeling tired, more of this, and you can't pinpoint what it is. And oftentimes, it's rooted in the mouth. So that's why I keep, having biological dentists like yourself on to, you have a different way to explain it. You provide such a unique treatment plan, and it's my favorite one so far. It really is. And I wish that you live closer. One day I will go to Dallas, and I want to come
have
visit.
A little retreat where we do the things.
Yeah.
But I think it's important to know, like, we all, as biological dentists, we all offer a different perspective, right? We come from different places. We do things differently, and they change over time. And I think from a systems perspective, that's where a lot of dentists are different, where, we have patients all the time who want this one thing, right? They're like, oh my gosh, I saw something. I've got root canals. I need them checked out. And that's great. But we do want to consider the whole person as we look at those individual problems. I think it's really a disservice to tell someone, like, these root canals are bad, they need to come out. That's the first thing that needs to happen, when they've got active gum disease and they've got cavities all over the place. Like, let's look and actually figure out what needs to come first, second, third, and what is your body actually ready to do. If we extract a tooth in a mouth that's not healthy, it's not healing. We're not really helping the situation. And then down the road, you're probably going to lose more teeth, and you've already spent all of this here, and we don't have a cohesive plan to figure out how we're going to put you back together again. So
yeah, because how often I know patients like, I've had all, it's just common. I always have something. I've had bad teeth. It's genetic. My mom did too. And I'm like, oh, no, I mean, you can change, we can figure it out. There's a plan, and you don't have to think that that's normal. There are different ways to do it. And so I just, if people, want to find you and find out more information, I know you've been, more active on social media as well. And so if you could share a little bit how they can find you or.
Yeah, absolutely. So my practice is called The Whole Tooth. Nothing but the tooth, just the whole tooth though. And we are in Dallas, Texas. And so our website is thewholetooth.texas.com. And our Instagram is at The Whole Tooth Texas. Facebook is at The Whole Tooth Texas. And we do have a TikTok presence, but TikTok's not my jam exactly. So I don't know what our handle is for that.
That's why my team here posts on there.
Yep, absolutely. And same thing with YouTube. I believe we have a YouTube as well. And then my latest fun thing is Substack. So I'm doing longer form content on Substack because I feel like it's a great way to cut through the noise of social media and all of the people trying to sell you their latest Amazon find. Just be able to get my thoughts onto a screen and read by eyes who care.
Okay, I love that. Well, thank you so much. I appreciate it. And again, if you found this information really helpful and you want to send it to family members, please subscribe, share it, and follow Dr. Preeya Gens and the Whole Tooth Dentist. I feel like I learned so much, and it reaffirms why I'm trying to bring breath work even into the dental practice for dental practices. I know I've done quite where I go to dental practices and the whole team, we do breath work. I'm also trying to coach dentists to provide breath work to their patients and themselves, mostly because I care for their well-being. And I've realized there's a correlation, a nervous system correlation for mental health in dentistry and for the patient. So I'm really honored to have you on, and I'm sure I'll see you again soon.
Yes, thank you for having me. This was so
Yes.
fun.